Right now, joined by a very special guest. This is Dr. Chadwick Hampton from Palm Beach Gardens Medical Center. Dr. Hampton, I want to thank you for your time. I know you're a busy doctor, and we are here to talk about the unfortunate situation of the Panthers captain, Aleksander Barkov, and the injury timeline with it. He could possibly miss the entire regular season with this. We talked about this kind of before this interview. We kind of looked at the video. ACL, MCL, underwent surgery. First of all, let's just talk about what those two things do for the knee and how crucial it is to an athlete like Aleksander Barkov.
Yeah, sure. Well, first of all, thank you for having me. I really appreciate you having me on today. ACL and the MCL. The ACL is a structure in the knee of one of the four main ligaments in the knee. ACL stands for anterior cruciate ligament, and cruciate means for a cross. So it's in the middle of the knee, and it stops the femur, which is the thigh bone, from and the tibia from translating anterior on itself, and that's its main function. It also functions in rotational moments as well. The MCL is another one of the four major ligaments in the knee. On the medial aspect, it stands for the medial collateral ligament, and the medial collateral ligament is associated for its stability on the lateral side and medial side of the knees. So there's four main ligaments of the knee, and apparently he injured two of the four.
Yeah, underwent successful surgery with the Baptist Health doctors, Dr. Uribe, expected to miss about 7 to 9 months. We were talking earlier, he underwent surgery to repair those, and there's kind of a difference, you know, if you tear it, if you don't, if it's just repair work. What are the differences when it comes to that type of surgery?
Sure, yeah, so usually you don't repair ACLs, you reconstruct them. The difference is repairing it, trying to get the native soft tissue to heal versus using a different structure, meaning your own tendon that you transplant from someplace else in the body, or a cadaveric tendon or someone else's tendon. But either way, you're reconstructing it. Repairs we found failed in the literature, and now we've moved past that. For the MCL, usually MCL tears are not surgical. They're graded, so 1, 2, 3, 4, 4 being the worst, of course. Grade 3 and 4s may or may not need surgery. 4 most likely, 1s and 2s do not. So it depends on the grade that he has or currently had. Apparently he may have had a reconstruction of the ACL and a repair of the MCL.
When you say repairing the MCL, so if it tears, sewing it back together? I'm speaking from a layman's term, and you're the doctor.
Correct. So there are multiple options and techniques to repair it. So you're using the same tissue and using either suture or some type of anchor device to anchor in the bone, and then using suture to shuttle through the native tissue to bring the tissue that has supposed to be here and has separated. You're trying to bridge that gap and bring that separation so then you can have end-to-end healing. The origin of the MCL, so in the medial aspect of the knee, it starts in the femur, the thigh bone, and attaches on the tibia. And so you're either going to connect it at either location with some type of technique for fixation.
You know, not just Aleksander Barkov's injury, but others. His was kind of non-contact. It happened before that. You would think with a surgery required, it must have been something catastrophic, and sometimes it is, but a lot of times no contact needed. Is that how fragile that can be for an athlete? That type of?
Yes, yeah. I mean, that's a good question. Non-contact ACL injuries are very common. Actually can be more common than contact injuries. A non-contact injury usually is a rotational moment, and it's a pivoting injury. So the ACL, again, functions with anterior translation, but also there's a rotational moment, and the knee has multiple degrees of freedom. And usually how it happens, a sports or athlete plants and they pivot, and that rotational movement and their weight gives and then pop. And then the injury occurs. It also obviously hurt injuries with impact or direct impact traumatic injuries, but then you can also have multiligamentous injuries, as we had last night, and another professional athlete down here in Miami.
Yep, we're going to talk about that in a moment. So all the fan base, everybody hopes the timeline is realistic to perhaps Barkov can come back for the playoffs, which would be April. That puts it at about 9 months. Is that realistic? Is an athlete more prone to recover sooner than others? And also keep in mind, whether he's in your care or what, these are players that have the top-notch medical care to do that as well. Is 7 to 9 months realistic? Is sooner even realistic?
Yes, however, not necessarily for the average Joe.
Right.
For a professional, first of all, they are a high-class athlete. They're not the average person in terms of their DNA and what's got them to be at this level playing a professional sport. So that's one thing. Second, it's their job. So they have their job 24 hours a day is to rehab this injury. Now, that all being said, the standard return time for ACL reconstruction is about 9 months to return to sport. You start agility drills at around 3 months in lateral motion, and you're continuing therapy throughout this time. But most of the time, you're not getting cleared to about 9 months. However, there's many instances that it takes over a year and up to more than a year to get back to the field or get back to the court. And you're not necessarily the same that first year. You return to sport, you're there, but it takes almost 2 years to get back to your pre-injury level of function for a majority of patients or athletes. Adrian Peterson was an anomaly. He was playing in 6 months after ACL reconstruction, but that's just not reasonable.
Yeah, almost superhuman.
Correct.
And the time frame has, usually as a sports fan, I saw a torn ACL, okay, they're out for the year. Or for, entire calendar year. That time frame seems to have shortened in recent history, and usually the explanation would be, well, medical advances. Is there anything you can point to specifically that's helping shorten that recovery time over the past 5-10 years for professional athletes?
Yeah, there's a few things. We've just gotten better in terms of the science. Our science is better in terms of our implantation and the actual techniques that we're using to do the reconstruction. They're evolving all the time, the actual placement, the timing of the rehab, adjuvants, adding a backup or extra stability, not just the graft or the tissue, but actual more suture to back it up to help protect the reconstruction while it's healing. We've actually added more things like PRP, which is platelet-rich plasma, which can help actually the incorporation of the graft, because the graft, you place the graft in the right position, but your body has to incorporate it. And it has to be what we call ligamentize it and turn it into your own ligament. And that takes a certain amount of time. So there's processes that we've developed and over time that has hastened that process. And then also the therapy has just gotten better. So we have improved in terms of timeline from let's say day 0, surgery day, to return to sport. However, a year is still kind of what it's going to be for most cases, especially if you're not a professional athlete.
Yep. Well, in this case, Mr. Barkov is the captain. Dr. Chadwick Hampton, thank you so much for joining us today. Explain that. We're going to talk about another sport here for WPTV, but for this purpose right here, Panthers 360. Now you have kind of a timeline and an explanation of it, exactly how Barkov went through surgery, and we'll talk more about it in the weeks to come.